Apa kabar, everyone? There's a number that pretty much every single Malaysian knows by heart. 1 ringgit. Just 1 ringgit. And you can see a doctor. It's something we're all super proud of, right? We love telling our friends from other countries about it. But you gotta wonder, is this medical miracle actually too good to be true?
I mean, think about it for a second. Just stop and think. A fancy cup of coffee these days, that can easily set you back 10, maybe even 15 ringgit. So how on earth is it possible that we get professional medical advice for a tiny fraction of that price? Let's really dig into how this whole thing works, because it's one of our most precious public services.
And when you look at the numbers, the difference is just, wow, it's mind-blowing. At a public clinic, you pay 1 ringgit. 1 ringgit. You walk into a private clinic, you're looking at RM80 to 200. And that's just to talk to the doctor, not even including medicine. And for something big, like a major surgery, we're talking about a difference that can be tens of thousands of ringgit. The value for money we get is just absolutely incredible. And you better believe we rely on this system. Oh yeah, big time. Over 70%. Think about that. More than 2/3 of all the people who need to stay in a hospital in Malaysia, they're in a government hospital. So this isn't just some backup plan, It's the absolute foundation of our country's health. And this isn't just me saying it. I found this quote from a fellow Malaysian on Reddit that just hits the nail on the head. They said, it's one of the very few things we can all agree on that the government has done great for the people. And that's so true. It's this massive source of pride for us, a real success story that we can all share, no matter what's happening in politics. But, and this is a big but, a system that's this cheap and used by so many people, well, it's gotta be under a huge amount of pressure, right? And after all these years of doing such a great job for us, some pretty serious cracks are starting to appear in that strong foundation. It's easy to take it for granted. We just assume it'll always be there. But behind the curtain, our healthcare system is really struggling. It's getting close to a breaking point. Those long waits we all complain about, or hearing about how tired and overworked the doctors are, those aren't just stories people tell. They're real symptoms of a much deeper problem in the whole system. Okay, so one of the biggest villains in this story, it's something called medical inflation. In Malaysia, it's hitting nearly 12%, which is one of the highest rates around here. What that basically means is that the price of everything, medicine, machines, even hospital beds, is just shooting up. And that makes it so much harder for the government to keep funding the system that we all need. And here's something you might not realize. Because the public system is stretched so thin, a lot of us are actually already paying way more for healthcare out of our own pockets. In 2022 alone, Malaysians spent over 22 billion ringgit. That's a huge number. It goes to show that while that 1 ringgit fee is an amazing lifeline, it doesn't cover the whole story. People are being forced to pay up for their own care when the system can't cope. So let's just lay it all out, nice and clear. What are the big problems? 1, our hospitals are just too crowded, which means we're all stuck in these super long, frustrating lines. 2, our amazing doctors and nurses, they're underpaid and completely overworked, so a lot of them are leaving for the private sector. Can you blame them? And 3, we're running out of specialists for really important treatments. These are the cracks that could bring the whole thing crashing down. Okay, so if this breakdown is starting to give you a much clearer picture of what's really going on, why not do us a quick favor? Hit that like button and subscribe. That way you'll always stay one step ahead on all of Malaysia's biggest issues. All right, so the problem is pretty clear, right? It's serious. But here's the good news. Experts aren't just sitting around and letting this happen. Nope. They're actually coming up with a new national plan to try and defuse this ticking time bomb and, hopefully, save the healthcare system we all cherish. So what is this big idea they've cooked up? It's called the National Social Health Scheme, or for short, the NSHS. Now listen up, because this could literally be the future of how we all pay for and get healthcare here in Malaysia. So what is it, in plain English? Basically, the NSHS is a plan to share the cost. Right now, the government pays for almost everything. Under this new idea, the bill would be split between 3 groups: the government, your employer, and you. The whole point is to build up a healthy, sustainable fund so that our healthcare system can survive for our kids and their kids too. Okay, so this is the official chart of how it might work. And yeah, I know what you're thinking. It looks super complicated, right? All those boxes, all those arrows. It's a bit of a headache. But don't you worry, we're going to break down the most important part of this for you, nice and simple.
And this table here, it makes the main idea super easy to understand. It all comes down to how much you earn. If you're in the B40 group, nothing changes for you. The government covers 100% of the cost, fully subsidized. For the M40 folks, it's a shared cost. The government still pays the biggest chunk, a massive 60%, while you and your boss each chip in 20%. And for the T20, it's a straight 50-50 split between you and your employer. See, it's a system designed to be fair, where those who can afford more contribute more.
Okay, so that's the plan on paper. But what does it actually mean for you, for your family? Let's talk about how this would change things in a real-life emergency when you actually need that medical care.
Yeah, let's get out of the theory and into the real world. Just imagine for a moment that someone in your family gets sick. How would this NSHS plan make a real, tangible difference in their life?
Let's look at a few examples. So meet Mr. A. He's from the B40 group and he needs an implant that costs 8,000 ringgit. Under this new plan, the NSHS pays for it completely, all of it. But here's the really amazing part. This is the game changer. Let's say the government hospital has a really long waiting list for his rehab. The NSHS could actually pay for him to go to a private center to get that treatment so he doesn't have to wait and can get better faster.
Okay, next up, Mr. B from the M40 group. He needs a surgery, but the wait at the public hospital is 9 months long. That's a huge wait. With the NSHS, the fund can step in and pay for his surgery to be done at a private hospital. No more waiting. He gets the care he needs right when he needs it. And you might think, oh, the T20 have private insurance, they're fine. But what about Mr. C? He has a serious heart attack. He has private insurance, but after a few months, his coverage runs out. And trust me, this happens way more often than you think. That's when the NSH becomes the super important safety net, stepping in to cover his long-term care so his family isn't left with these gigantic, life-destroying bills. So you see, it's a system that helps protect everyone. So when you look at it like that, you can see this whole idea isn't about getting rid of our amazing public health care. Not at all. It's actually about saving it. It's about making sure it's strong and healthy for the future, so it'll be there for our kids and even our grandkids. All right, so let's just quickly sum everything up. We have this healthcare system that we are, quite rightly, super proud of, but it's in trouble. It's facing these huge threats from rising costs and just too many patients. And the plan on the table, it's all about sharing the responsibility so that our system doesn't just survive, but it can actually thrive for years to come. Hey, thanks so much for sticking with us through this. If you want to join a whole community of Malaysians who prefer clarity over confusion, go ahead and tap that like button, hit subscribe, and let's keep making sense of these big topics together. And all of this leaves us with one last really big question to think about. Our 1 ringgit doctor, it's a national treasure, right? But it's a treasure we're in real danger of losing. So we have to ask ourselves, honestly, is sharing the cost, the price we have to pay to protect this incredible healthcare system that we all love so much, something to really think about?